We also, if you're not familiar with Zoom, if you scroll your cursor at the bottom of the screen, you'll see a little icon that says chat. If you have any questions for any of us during the session, please feel free to write your question in the chat. Elsie, our graduate research assistant, will be monitoring the chat, and we can answer the questions during the session. Also, if you want to hold your questions till the end, that's also an option. We'll be holding a Q&A after we finish the presentation, and any of us will be happy to answer your questions also. So I'm going to get started. I'm going to introduce myself first. I'm the Area Director of Training Programs for the Latino Research Institute. My name is Dr. Morales Campos. I'm happy to host and MC the information session. And then my colleagues that are joining me today are Dr. Vanessa Erisudis and Dr. Marisol McDaniel. And they'll be talking towards the end of the information session and giving you information about their projects. Elsie, if you can advance the next slide. So this is our agenda for today. I'll be giving you a little information about what the Latino Research Institute is, who is at the LRI. Dr. Erisudis and Dr. McDaniel will give you an overview of the projects that they're in charge of. Given that we're such a small group, we won't have a breakout session. We'll just have a Q&A session afterwards. And like I said, feel free to write down your questions or put them in the chat, and we'll be happy to answer them at the end of the session. Next. So to start off, the purpose of the LRI, we all know that Latinos are a majority minority in the United States, and even more so in Texas. The purpose of the LRI is to develop world-class leaders in creating and advancing knowledge that sustains healthy and productive environments and promotes social justice for Mexican American and Latino communities across the US. And we also want to expand and be able to work with communities in also the Caribbean and in Latin America. Next. So Latino health disparities basically mean that Latinos have a greater risk of developing health problems. And some examples can be like cancer or obesity in greater numbers. And this also means not only developing these health problems, but also dying from them. And that's called like an increased mortality risk compared to folks that are non-Latino. So with the health disparities research that we do at the LRI, we're trying to advance scientific knowledge by defining what we call the determinants of health, or what are the different factors that are influencing these greater risks that we see in the communities. And also with our research and the data that we collect, we're using that knowledge to develop interventions that help to reduce these risks and these disparities that we see in our communities. Next. So the mission of the LRI is just basically to provide infrastructure for the creation and dissemination of quality data that can help with supporting different issues that affect Latino populations. And like I said, we're doing it not just like here, say, in Austin or in local Texas cities, but across the state, and also like nationally collaborating with different people in the United States and also abroad. Next. So how do we achieve our mission? We establish equitable and sustainable partnerships to develop an agenda to address community identified research priorities. So that's what we call community-based research. We work with people in the community that are what we call the boots on the ground, and they help us to identify like what's important and what we need to focus on. We don't want to do like a top-down approach where it's the researcher informing the project, but working with community members because they're the ones that are more informed about what's actually going on. And then we also conduct health, social equity, cultural studies, and public policy research in different areas. In the LRI, we span children, youth, families, women's health across the lifespan. We also do US-Mexico binational studies on migration and health. Another area of focus is also mental health and also LGBTQ health. We also build and strengthen pathways to successful research careers through the area that I'm responsible for, which is called the training programs. And we help Latinos from undergraduate to master's to the doctoral level. We have different mentorship programs. We have a summer institute that's for doctoral students. We try to provide information sessions like these to be able to do internships with graduates and help them connect and build their network with other faculty and researchers on campus. Next. So why would a student want to be involved in research? So there's a bunch of reasons that you all could be here. Some folks are interested because they have program requirements for their degree. It could be like a thesis or an internship requirement. You might have applied and been accepted to certain programs on campus, like the undergraduate research apprenticeship program, and you need to find a project to work on for this. You might just be interested in exploring a new field or even developing a new skill. You might just be interested in social justice, which is a big theme that's going on with these current political times. Or like I said, you might just be interested in earning course credit that you need just for your degree and be able to graduate. Next. So why would a student want to be involved in research? So there's a number of implicit benefits that you might not have thought of. One big one is developing good habits. By working with a supervisor faculty on a research project, you'll learn things such as time management, also learning how to prioritize different tasks, given the duties that you're doing for whatever project you may work on. Also, it helps to guide and develop what your personal values are, which will help you figure out what your career course might take if you want to continue in school, if you want to go out in the workforce. It'll also help you gain transferable skills, such as like data entry or other things that you might use in school, but then will also help you in your career or if you further your education. Also developing a growth mindset. And what a growth mindset is, learning new things instead of thinking that you're stuck with the knowledge that you were born with, but being resilient and be able to adapt and learn new skills as you're working with us on different projects. Another big one that we do is professional development. So just simply like how to write, appropriate email to say someone on a research project or a faculty member, because you will be working with people as you work on a team with your supervisor. How to do networking and team building, and then also just foster independent thinking as we ask for your ideas on different tasks that we're doing, whether it's say developing an education curriculum, doing a flyer, anything like that. We love to get your input and as you're learning skills and helping us with our different tasks. And also, of course, leadership skills. You'll learn from us, how to manage different things. And we hope that that'll give you some skills that you'll apply later on in your careers. Also, if like you're planning to go to graduate school or apply for a PhD, there's all these unknown questions on, how to do these procedures. And we've all been through that process. We've been, in your shoes as undergraduates. And we can help answer any questions that you might be unsure of regarding the academic process. Next. So these are the researchers. I've already introduced myself. So I'll let Dr. Erisudis and Dr. McDaniel give you a little bit of background on them. And then I believe the first person who will speak will be Dr. Erisudis.
Hi. I'm Dr. Erisudis. I'm a research associate with the Latino Research Institute. My research primarily deals with child and young adult obesity and factors that influence the development of obesity in these populations. I'm particularly interested in working with rural Latino populations and developing sustainable and effective interventions. The majority of the projects that I work on and that I will speak about today are healthy lifestyle interventions designed to promote healthy growth in Latino children and to promote a healthy lifestyle among Latino families.
Dr. McDaniel, do you want to do a quick introduction of yourself before Vanessa gets started? Did we lose her?
I think we might have. I
think we lost her.
Oh, we did. Okay. Well, when she comes back, we'll have her introduce herself to everyone. You can go ahead and get started, Vanessa.
Okay, great. Thanks. All right, next slide. Here we go. Okay, so the first study I'll speak about today is Míranos. This is a healthy growth intervention that is implemented in Head Start centers in San Antonio. And the purpose of this study is to compare the effects of two different types of interventions. One targets primarily center-based policy changes, and the other intervention targets not only the center-based policy intervention, but also has a home-based component where we engage parents in learning about health in their preschooler, as well as promoting healthy lifestyles at home for their preschooler. And we're comparing these intervention effects to a control program. It's a reading program on child overweight and obesity. Right now, we are wrapping up data collection for this study, but there are all sorts of research activities that can be learned about or completed if you're interested in healthy growth among preschoolers. So for instance, we are collecting a lot of data and we need a lot of assistance doing data entry and data management. This includes database development. So working on this study, many of the students who come in and work on this study learn about REDCap, which is one of the database management systems that we use for all of our studies. And so learn how to work with REDCap, building in survey forms, learning about constructing surveys, essentially. The other thing we're working on with Míranos right now is digitizing and archiving study materials. So as part of the intervention, we created a ton of training manuals so Head Start centers could implement the program on their own. And so now we are creating digital versions of all these training manuals, as well as video presentations and video lessons that were created for centers and parents at the center. And all of these are being uploaded into ultimately a repository. So Head Start centers across the country can use these materials if they're interested. And then finally, again, I mentioned we're completing data collection, and so we'll be working on manuscripts and publishing those manuscripts. So there will be opportunities to learn how to conduct literature review and learn about academic writing. Next slide. All right, one of the other studies that I work on is Poder, and it's a very, very long name up there. Maybe you can see it. Promoting obesity prevention among children with developmental disabilities and their families through engaged research. That's a mouthful, and that's why we call it Poder primarily. This study, there's very little research that's been conducted among children and adolescents with intellectual and developmental disabilities and their families. particularly with regard to overweight and obesity and health behaviors that contribute to overweight and obesity. And so this study, right now, we're collecting survey data from 6 to 17-year-olds with diagnosis of an intellectual or developmental disability and their caregivers. This is a 2-site study, so I'm working primarily with the Austin, Texas site, and don't really do a lot with the Chicago, Illinois data collection process, but we do collaborate quite a bit to make sure that we're all on the same page. So like I mentioned, for this study, we are in the process of collecting data from these parent-child participants. We are responsible for managing the data. So we manage not only Austin, Texas sites data, but also Chicago's data. And we also update, it's another opportunity to work with REDCap, not only as the database where we manage our data, but also learning about modifications to existing survey forms is something that whoever wants to work with this study will learn. The other thing that Austin, Texas is responsible for is preparing and distributing study equipment to participants by mail. So as part of this study, we collect physical activity information using accelerometers. And so interns on this project learn not only how to use the software that's required to initialize and collect data using these monitors, but also analyze that physical activity data. And this is one of the projects where we actually have a paid undergraduate research assistant position available. It will start June 1st. And after this, this session, Elsie will send out information, the link to the posting. I believe it'll be on Handshake and on Eureka. So if you're interested, stay tuned. We'll have that information for you after the session. All right, next study. Okay. So the last project I'll talk about is Healthy Frio. It's also known as Healthy Rural Texas because we expanded out of Frio County and are now working with several rural counties outside of San Antonio. The purpose of Healthy Rural Texas is to compare 3 healthy lifestyle interventions and their impact on Latino families, obesity, physical activity, and nutrition behaviors. These interventions, one is a control group, the other 2 are based off of a YMCA program, something that the YMCA of San Antonio developed. Right now, we are not doing the in-person program because I'm sure, as we are all aware, we cannot due to COVID, but we are still recruiting for our remote technology and control interventions, both of which we're able to conduct activities virtually. Let's see, for this study right now, we do have opportunities again to learn about data collection as well as accelerometer processing. So those are those activity monitors that I mentioned from the Poder study. We also use them for Healthy Frio. And so again, opportunities to learn how to use the software, learn how to analyze physical activity data. We also work to create participant progress reports. So at the end of each data collection cycle, we work to send participants information about how they're doing. So that means we take their nutrition data that we've collected, their physical activity data, and their weight, and present it in like a little progress report for these participants. And then other things that are ongoing include updating these community resource guides as we continue to branch out to different rural counties in South Texas. We need to continually update the resources that we provide participants about, you know, food markets, or farmers markets, or physical activity resources that are in their area. And I think that is about it for me. So
Thank you, Vanessa.
Dr.
Dr.
McDaniel.
Dr. McDaniel, can you introduce yourself before you start, just so folks learn a little bit more about you?
Yeah, of course. Sorry, y'all. My internet in the afternoon is iffy. Hi, I'm Dr. Marisol McDaniel. I'm a postdoctoral research fellow at the Latino Research Institute. My personal research is around a lot of things with food and health-related social needs among everyone, especially individuals who hold multiple non-dominant identities. And I think that's all it about me, but I guess we'll talk about some of the projects I'm involved with. And LASE is one of the big projects that I was involved with, and I guess kind of give a little bit of history of my relationship with the LRI. I've been working with the LRI since 2014, and so LASE is a program that's been over for a few years now, but we're still working on getting all the data together because we collected just so much data. And basically, Enlace is a 16-week intervention comparing physical activity intervention that was implemented in community centers along the Rio Grande Valley versus an intervention that's like more a community health safety program that was also implemented at community centers. And these were all women, older women, in case you're interested in that population. But again, as far as research activities, we need to do a lot of accelerometry reprocessing. So going back and we have all the data. We just need to change like certain variables within the data and reprocess it, and as well as data entry and management, especially for our process evaluation data that we have. So anytime like participation data, anything that you wouldn't consider like part of like the outcome data that we were still collecting to make sure that the actual intervention was implemented not successfully, but effectively and by protocol. We have that data. And we also, as Dr. Eddie Sudis mentioned about some of the other studies, we are in manuscript mode as well. And so Enlace can give you the opportunity to get some experience completing literature reviews. Another study I've been involved with over the years is the Health for Kids study. This study is also already completed. We're just kind of doing a lot of data verification, as well as, again, the accelerometry reprocessing. This study was among children 6 to 11 years old that lived in San Antonio, mostly around like the South side. So the two clinics that we were working with were the Southwest and Southeast Clinic, University Health Systems Clinic in San Antonio. And again, randomized controlled trial, we're looking at a intervention for healthy lifestyle intervention for children versus children who just received usual care. And again, as I mentioned, it's through the clinics. So everyone's kind of receiving some type of intervention as far as if they have a weight issue, if they are overweight or obese. But the actual intervention was a lot more in depth. For example, we have like health educator phone calls, which will be part of a survey data verification. We'll be helping like transcribe those to see what was actually talked about during those health educator phone calls, as well as just so much data. We have so much data at the LRI that we need help with verifying and reprocessing and all of that. And then the last project that I want to talk about is the Data Services Group. It's not necessarily a project. We have a lot of small projects. So for example, right now we are working on a project with the University of Maryland and with Gilead, which is a pharmaceutical company, and they're the ones that that create PrEP. And I can't even think of what the PrEP stands for right now on top of my head. But basically, it's a vaccine in a way to stop the transmission of HIV. And so we're working with physicians to see how they are like, what are the prescribing practices of PrEP for Latino communities? So men who have sex with men as well as transgender women. And so that's one project we're working on. So we're having to come up with a survey, come up with this database, make sure we're reaching all of the correct physicians nationwide. So we need a lot of help with that. Even though it's a smaller project, it still involves a lot of data science. So a lot of survey development, survey data verification. Once we receive all that data, how are we going to format that data, as well as archiving that data in case other individuals are interested in researching prescribing behaviors among physicians. We also have accelerometry reprocessing that kind of goes across all of the studies, but we may also receive accelerometry reprocessing contracts from outside researchers. They may want help with, again, creating those special variables to be able to look at the accelerometry data the best. And another contract we have, top of my head, we have a few contracts with UT researchers that are in the works. But basically, this is just the data group. So if you're interested in data science, if you're interested in just getting your hands on some data and really starting to work and understand data, this is a good opportunity for you.
Thank you.
Thank you.
As I stated earlier, we won't have a breakout session since our group is so small. So we'll just go to the question and answer session. If you have a question for either Dr. Eddie Soudis or Dr. McDaniel, please feel free to unmute yourself and ask away.
This is not a question for like someone specifically, but I was wondering if there are any other projects that are not like health related or in other areas.
The projects that I'm specifically involved with are mostly health related, but I am involved in a few education projects, looking at educational policy or looking at students and how they're navigating higher education. So we have projects like that. I mean, there's also other projects coming up, but as far as what like projects we really need help with right now, most of them are health related right now.
Okay, yeah, just wondering, because like my main interest is housing. I'm an urban studies major, so my main interest is affordable housing or something with urban issues related. But yeah, thank you.
But as I say that, I mean, it's health related, but a lot of our studies are still looking like at the social ecological model. So we do capture a lot of data about not necessarily policies per se, but this is experience of Latinos past just their health experience. So we do capture a lot of that data that can be used to inform policy. So we have a lot of, for example, right now as part of our COVID consortium group, which is kind of a special project that we're working on policy briefs. And we would definitely love somebody that has some policy experience to help us as we create those policy briefs that will also start to, sorry, my son is in here with me right now, which will also probably used for other studies as well, some of the health studies. So we do need help kind of bridging that policy and public health research gap.
Okay, thank you.
Does anyone else have any other questions? If you look on the screen, oh, they're not on there. Elsie, can you scroll back to where their emails are at for Dr. Eddie Soudis and Dr. McDaniel? If you all, oh, I'm sorry, was someone gonna ask a question?
I'm sorry, I did see a question in the chat asking
let me see.
how long the assignments last, how many hours per week are required. So, you know, projects are ongoing. You know, just because one study, I guess, ends doesn't necessarily mean that that's it, you know, we're done with you, get out of here. What it means is that you know, as long as you are interested in working with the LRI, or we are interested in having you. And so, you know, we typically start with kind of a semester trial, you know, basis. So now it would be summertime, for instance. And then if the relationship, the working relationship is going well, then we continue to have people intern with us. Sometimes this translates into paid positions or other type of internship opportunities like the URAP. But in terms of how long the assignment lasts, again, it's however long the interns want to continue working with us. And for hours per week, we typically ask our intern volunteers to start, I guess, anywhere between 5 to 10 hours a week volunteering on a particular project or set of projects. You know, paid positions are a little bit different, so.
So can you repeat again, Dr. Adisudis, how many hours the volunteers, is it however much they can contribute, or do you have, like, is there a minimum they have to?
We ask for a minimum of 5 hours a week.
Okay,
But typically most people start off between 5 to 10.
okay. Thank you.
Yeah, thank you.
Let me go back to my thought. If you're interested in emailing either Dr. McDaniel or Dr. Adisudis, so right now on Zoom, you can see Dr. McDaniel's email if you want to email her directly. And can you scroll back a little bit, Elsie, to get show Vanessa's email? I'm not sure where it is. I think it's before that. So if you're interested in reaching out to Dr. Adisudis, you can see her emails there is listed there on the slide. Unless, does anyone else have any other questions for our speakers?
The emails are also in the chat too.
Oh, thank you, Elsie.
Yeah, I have a question.
Yes, go ahead.
Yeah, so like a lot of the projects deal with obesity. Is there like a certain aspect of obesity that each project like focuses on, or is it just like general health?
So we collect a couple of different measures of obesity for the majority of our studies. So of course we have height and weight measurements. Most of these are conducted with a stadiometer and a scale, a Tanita scale. So that's one, of course, BMI, right, would then be one of the obesity outcomes that we look at. We also measure, because we use a Tanita scale, we have a percentage of body fat that we also look at as an outcome. And then our third obesity related outcome would be waist circumference. So those are the three primary measures of obesity that are taken across the majority of our studies. And then of course, we are interested in collecting, like Dr. McDaniel mentioned, factors across the socioecological model that might impact obesity among these populations. So whether that's individual behaviors like physical activity and diet, or psychosocial constructs like self-efficacy and social support. We also collect environmental related data. So what type of resources do they have in their communities that contribute to physical activity or a healthy diet, as well as other general variables like income. And we also have zip codes. So sometimes we also look at kind of census tract information. So it's kind of just a smattering of all the data that we collect.
Okay, thank you.
Yeah.
Dr. Adisudis, there's a question in the chat. I'm not familiar with the study the student is asking about. I don't know if you have any information. I think it's probably one that hasn't been hasn't been open yet. It's the social cultural stress profile study.
Oh, I see. I do not have any information about this particular study. My understanding is that this is primarily conducted with Dr. Kim's lab, and the Latino Research Institute is sort of tangentially associated because Dr. Medina, who's our director, is an investigator on the project, but currently the Latino Research Institute is not assisting in terms as we normally would for studies like with regard to data collection or processing. I believe all of that is done through Dr. Kim's lab. So if that is a study that you're interested in, you may want to reach out to Dr. Kim and find out how to volunteer.
Thank you. We appreciate it.
Mm-hmm.
Elsie, can you go to the last slide in the PowerPoint? So as soon as Elsie gets to the last slide, that has all our contact information for the training programs. That's our main email account, the LRI account. If anybody's interested in having any more information, we will send out, like I said, the link for the video for the information session. It'll also be posted on our website in case you have friends that might have been interested, or you know of anybody that might be interested in any of these studies. Please feel free to share that with them. Other than that, we'd like to thank you all for joining us today and thank our speakers for giving up their time and providing this useful information for everyone. Thank you, and everyone have a great rest of your afternoon.
Thank you. Have a good day.
Bye, y'all.
Bye, everybody.